Smart Care. Sustainable health for the future.
Six months ago, Stefano De Santis sought help. He was overweight, had high blood pressure and high cholesterol. With the aid of nutritional biologist Serena Capurso, he's lost 11 kilos.
Recently I wasn't feeling very good, and so I decided to do some blood analysis, and the results were catastrophic. So, through a friend, I asked help from Dr. Capurso. I was very worried because I wasn't sure I'd be able to follow a diet.
Diseases linked to obesity are a serious threat to the sustainability of healthcare systems. Wider trends in society don't help the situation either.
We have the impression that eating healthily has become too expensive in economic terms. And then there's advertising surrounding us that pushes us to choose garbage products, junk food, high-calorie content, and so the consumers end up being confused.
Spazzatura particolarmente ipercalorici, è chiaro che il consumatore finale è anche un consumatore che è confuso.
Obesity rates have doubled worldwide in the last 30 years, and the problem isn't going away. Here in Italy, 1 in 3 children is classed as overweight. Policymakers need an effective response, but how are they going to know what will work? I'm off to the University of Rome to meet a professor who's going to help them choose the right path. Economist Vincenzo Atella has worked with the OECD to develop what's called a micro-simulation model that aids policymakers weigh up the most cost-effective approach to obesity.
We did a series of simulations, and they said that if we succeeded in having a population at the age of 50 in better health in terms of the level of obesity compared to the current population, this is how much we would be able to save. The model's benefit is not to predict the future, but the capacity to say today to politicians, if you have 2 possibilities, 2 things you can do, we say if you do A or if you do B, this would be the result.
Such choices could be advertising regulation, food labelling or education, investments which take decades to pay off. So how do you persuade politicians to act? We asked Italy's top health advisor, Walter Ricciardi.
To get politicians to do something, we need to do 2 things. The first thing, give them scientific and solid evidence, otherwise they are just opinions. And the second is to play on their leadership and their ethics, because the money that they are going to invest now will have some results when they are not in power anymore. And it's important to persuade the politicians that they don't have to think only about the next election, but also about the next generation.
That younger generation appears to be abandoning Italy's famous Mediterranean diet, while other factors are also aggravating the situation.
Physical activity has become undervalued when it should be the starting point. And I see in our primary and secondary schools that sport and physical education is being absolutely sidelined.
The difficulty now is to select the right policy response. According to the OECD, 75,000 deaths per year could be avoided if a comprehensive strategy to deal with chronic diseases linked to obesity was implemented in Italy.
Smart Care, in partnership with AbbVie.